to talk more about this, we're going to bring in Dr. Abdul Al-Said here, assistant professor at Columbia University, and Susan Dentzer with the Robert Wood Johnson Foundation. She is in Washington, D.C. for us. All right, both of you, thank you for joining us. Dr. Al-Said, I'll start with you here. First, how important is this issue that it actually brought both parties together, supporting this bill together on a level like we've never seen before?
Well, Medicare is one of the most important and largest issues that we pay for as a national government. And so it's a huge issue. And we've known for quite a long time that folks on both sides of the aisle hate the way that Medicare is paid for right now, as do doctors, as do Medicare beneficiaries. And so this is one of those issues, rare issues in our national discourse that actually brings together multiple sides on the same conversation.
What do you think about this?
I think it's an important plan. One of the most unique aspects of this particular plan is it starts the conversation around how you pay for value rather than how you pay for service. And one of the big issues in the way that we pay for Medicare is it incentivizes doctors sometimes to do things just because they can get paid for them rather than doing them because that's what's best for their patients. And so starting to move the conversation towards how do you make a patient's health better is a good pivot. Now the challenge with this, of course, is how do you actually define what better is?
Right.
And this is something that's sort of left a little bit up to discretion, and in this way, sort of kicking the can down the road.
All right, we'll talk definitely more about this idea of value-based care. Let me bring in Ms. Dentzer here. Take us back to 1997. Why was this mandated in the first place?
The volume of physician services under Medicare has been growing for many, many years. And some people worried that because of the way we pay doctors in the traditional program, which is on a piecework basis, it's as if you were paying cobblers to make shoes based on every pair of shoes that they made, regardless of whether people wanted to buy those shoes and regardless of whether the shoes were any good. So the incentives were for doctors to do more and more and more because they got paid on this piecework basis. And the rates of those expenditures were going way, way up. So Congress said, enough, we have to come up with some kind of a formula where if the volume of services really does go up, doctors will get paid less so that the combined expenditure isn't as great as it would be otherwise. That was the rationale for the program. And essentially what happened is that would have dictated these big cuts in physician payments. 17 different times Congress avoided those cuts, as Congressman Boehner said in the setup piece, because the degree of the cuts were going to be so big because these expenditures were going up so rapidly.
Yeah, and I want to stay with that point here. Let me bring in Libby Casey. Libby, 17 years that you pointed out, these so-called Band-Aid fixes. Why did it take so long to tackle this?
A lot of it was the nuts and bolts, trying to figure out how they could find a more lasting solution. But also these patches have worked. Congress really often functions on a deadline approach. Wait till the last minute and then fix this. The thing about this ultimate change, though, that's not a patch but would be a fix, really the biggest change to Medicare in 20 years, is that this has been increasingly anxiety producing in Medicare recipients because they're hearing from their doctors year after year, I may not be able to serve you anymore as your physician if this payment changes. And so that has been an ongoing sort of lurching problem for both Medicare recipients, the patients themselves, a lot of frustration for the doctors. And you talk to members of Congress who are themselves doctors on both sides of the aisle. They have long wanted to fix this. It just comes down to figuring out the right formula for compromise.
Okay, and Dr. Al-Said, take us through the current process right now, just to let people know exactly what goes on. If you're a doctor treating Medicare patients, how exactly do they get paid?
Yeah, so a doctor will see a patient, they'll log what exactly they did for that patient, and then they will bill for those services. And then Medicare will then pay the doctor for those services after the fact. And so this is the way that it works. Now you can imagine, as Ms. Casey said, this causes a lot of consternation on both the doctors and the patient's behalf, because the doctors are thinking, well, if you guys don't pass this thing, I'm not going to get paid for what I already did, and I can't trust Medicare. And what happens then is they say, well, you know what, I can find people who are insured and take care of them, and they'll pay me for sure because it's not this big political football, and so I'm going to stop taking Medicare patients.